I don't think we know for sure exactly why that happens, but it is a common behavior. The more one begins to try or do a movement with them, less impaired upper extremity, you see some exaggerated motions in the opposite direction. Probably because our systems have bilateral representation. It's not all one side governs the other side, as we're taught, but there's some bilateral representation. And what may be happening here, that bilateral representation is imbalanced. So you get an overflow or disproportionate amount of activity that is opposite to what we want. So as we know, for the upper extremities, muscles which bend the elbow and bend the wrist and fingers tend to be disinhibited. The fine control between this movement and this movement is often lost in folks who've had a stroke, for example. And so when we're asking someone to show what we want them to do with their less impaired upper extremity, and we start to see the opposite movement, patients might even be aware of the fact that they're doing that. And the more they worry about it, the more tense they get. So one way of trying to overcome that is to do parallel concurrent movements at the same velocity. It should not be an all or nothing phenomenon. So for example, one might say with the better upper extremity, see if you can move your wrist up just a small little bit. Can you do any of that with your impaired upper extremity? It's not an all or nothing phenomenon. And just do gradations. And you tell me when that seems to get harder. How far can you go before we do this? This becomes one of the points where recognizing these differences make the potential for a robotic feedback device very important. Because it's hard to quantify how many degrees, what that really means. The robotics afford a metric, a way of measuring this difference and actually showing it to the patient so that they learn that they have a certain goal to achieve in a certain direction, and can they gradually increase that goal. Gaming interfaces, which relate to a task, a fun task, to the motion itself, and recognizing that if I don't do this the right way to the range I want to get to, I'm not going to succeed in the game. How that information is integrated to retrain our nervous system, we don't think we know for sure, but certainly the gaming conceptualization is one that many of us can identify with, and wanting to succeed is even better, and recognizing it's not an all or nothing, it's not necessarily how hard you try, it's how precisely you try within the guidelines or limits that have been set.